Good evening, everyone. My name is Les Smith. I'm with the Michigan Department of Environment, Great Lakes, and Energy. It is my pleasure to welcome you to this evening's MPART PFAS Regional Information Webinar featuring Jackson and the Kalamazoo regions. Joining me behind the scenes is Mr. Jim Ostrowski and Mr. Fred Sellers from the Kalamazoo District Office, who will be both serving as co-hosts and moderators this evening. Before we welcome our first speaker of the hour, I'd like to go over a couple of housekeeping items for you. If you're new to Zoom, we just wanted to let you know, next slide, Fred. We will be recording the webinar, and all lines will be muted during the webinar, which means that you can hear us, but we can't hear you. But I know that you'll have questions about this evening's content, so there's some options for you. First, I want to let you know, if you're not familiar with Zoom, that at the bottom of the screen, there's a question and answer box. You can type in your question about any of the content that you're seeing throughout tonight's webinar at any time during the presentations. Type your questions, and we will be addressing those during the question and answer session later this evening. The second option will be, if you'd like to ask a question of our panelists this evening, when we get to the question and answer session, you can use the hand icon also located in the Zoom webinar menu at the bottom of the screen. You can raise your hand and we'll see you. It's an electronic way to let us know that you would like to speak. And the third option is for our listeners who are on the phone. You can touch the star and the number 9 key to electronically raise your hand on the phone, and we will also see that here and be prepared to unmute your mic so we can hear your question. So those are the ways that you'll be able to communicate with us this evening. And with that, I'm going to step out of the way and introduce Mr. Steve Sliver, who is the Executive Director of MPART, and he will welcome us and introduce us to PFAS 101.
All right. Thank you, Les. Can you hear me good? All right. Well, good evening, everybody, and thanks for the opportunity to introduce you a little bit to MPART PFAS and what we're doing in your communities. And we go to the next slide, please. And so I'm here representing Michigan's PFAS Action Response Team, or MPART, and its agencies are responsible for environmental, natural resources protection, agriculture, human health, also for airports, commercial airports, and transportation and military facilities. And we have a coordinated approach here in Michigan, multi-agency, all things related to PFAS. And we also work, in conjunction with our local and federal partners to make sure that we're leveraging our resources and all on message to rapidly identify and reduce exposures to PFAS throughout the state. We basically have a very data-driven, science-based approach, and it's really the reason Michigan has been so successful at addressing PFAS contamination. And go to the next slide, please. And so what are PFAS? These per and polyfluoroalkyl substances. The one thing they all share in common, there's over 5,000 of them, is they have a really strong carbon-fluorine bond. It's one of the strongest bonds in organic chemistry. And in these compounds, they're surfactants. They like to behave or exist at the interface between oil and water, for example, or air and water, right at the surface. And they're repellents of oil, water, fat, and grease. Many of them have been around since the 1940s. And something that's unique about these is they're not all the same. So when we say PFAS, that's a broad class of compounds. We know a little bit about some of them, but not everything about all of them. And it's a lot easier to talk about really where PFAS are not used than where they are. They're used in, food packaging, those aqueous film forming foams for fighting fires, Scotchgard, and metal plating industry. Next slide. And so why are we concerned about these? Well, they're used in they have so many broad applications, and we're finding out that they don't break down easy. And again, that strong carbon-fluorine bond means that they continue to exist in the environment. You've heard the term forever chemicals. And we're finding out that some of them are bioaccumulative. That means they kind of build up in our bodies, and it takes a while for them to leave our bodies. And some of them have been associated with adverse health effects. Seisha will talk to you a little bit about that in a few minutes. And, you know, like many contaminants of emerging concern, we don't have all the information we'd like to have about them yet, and there's not consistent national regulations for them. So next slide, please. So I like to use this to illustrate really one of the big challenges we have with these persistent compounds. And so basically how we are cycling them throughout the ecosystem because we're not breaking them down and we're not accumulating them in one place. So the landfill really is a great example of this. Remember, all of the different things, the applications and uses of PFAS, they end up in consumer products, for example, that end up in a landfill. And the PFAS end up in the leachate from that landfill that's collected and then discharged to a wastewater treatment plant. The landfill and the wastewater treatment plant aren't really effectively treating PFAS compounds, so they could end up being discharged out into our surface waters, impacting fish and drinking water sources. And some of the PFAS can accumulate in the wastewater sludges or biosolids that are land applied then in agricultural fields, impacting soils, groundwater, surface water runoff. And so really our challenge here is to really identify the occurrence of PFAS throughout this cycle so that we can break it and protect public health. Next slide, please. So we've really taken a multi-pronged approach to address PFAS in water. And that's what I want to focus on here a little bit tonight is our investigation, starting with surface water. So we've integrated the testing of PFAS just like we do for other persistent toxins like PCBs and others throughout our surface waters across the state and fish. So this helps us to identify where there might be some higher concentrations than what we would otherwise expect, and we can track down sources and eliminate those. We've also found high concentrations of PFAS in foams that are generated on surface waters that are impacted by PFAS, and this helps direct us to where we might be looking for other sources of contamination. And our wastewater treatment plants have been working throughout the state with their industrial users to identify who has high concentrations of PFAS in their discharge so that they can eliminate that before it makes it to the wastewater treatment plant where it could then pass through or impact the biosolids. Next slide, please. We've also gone direct to testing people's drinking water. And so Michigan began back in 2018 with the most comprehensive evaluation of PFAS in drinking water, testing all of our public water supplies and the schools and daycares, for example, larger ones that were on their own wells. And we've been expanding that testing to other regulated supplies for some of the more vulnerable communities like other daycares across the state. And we've also gone back and monitored, the surface water systems, those that have surface water intakes, to get a better handle on how the concentrations of PFAS, if they're found at all, might fluctuate. And we've gone back to any of those systems where we found concentrations of PFAS that we might like to get a better handle on fluctuations in them as well, and done some quarterly monitoring there. You can go to the next slide, please. And so this is an oversimplification of the results that we've gotten over the past couple of years, but I think it illustrates well that about 90% of the systems that we tested didn't have reportable or detectable quantities of PFAS. And it's those 14 compounds with the acronyms there on the slide that are all evaluated under the EPA method for drinking water. And another 7% had some detections, but they were really, really low. Total all those 14 up, and it was less than 10 parts per trillion. And the scientists were telling us at that point in time that those likely don't need much more than ongoing monitoring and making sure that the customers of the supplies are aware of these results and what's being done about them. 3%, and that was those systems that we've been doing quarterly monitoring on, for example, had something between that 10 parts per trillion and of total PFAS and that lifetime health advisory level from the EPA of 70 parts per trillion of two compounds, PFOA and PFOS, in any combination. And essentially these systems were all, told to notify their residents, look for potential sources of contamination in the area, do the additional monitoring, and look at options should they need to add some sort of a treatment or look for an alternate supply. And of course, we had 3 systems that actually exceeded that 70 parts per trillion and had an immediate response with alternate water. So, but what that survey of our drinking water supplies told us is that, we do have PFAS in some of our drinking water systems, and we need to monitor on a more routine basis. This was all the state doing the testing on its own, and typically we look to the federal government for standards in drinking water, and we adopt those at the state level in our drinking water programs. But the federal government is, doesn't have any standards for PFAS in drinking water, and their schedule for adopting those is pretty far out. We also knew from a science advisory panel that reported out to MPART back in December of 2018 that 70 part per trillion standard I mentioned is probably not low enough to be protective, given what the science is telling us about the effects on people. And we should also be looking at more than just those 2 compounds. So Michigan back in 2019 took an approach to first go to another science advisory work group to identify health-based values for any of the compounds that would be analyzed in drinking water with EPA methods, and ultimately to develop rules. Next slide, please. And so August 3rd, not too long ago, this year, Michigan made it through the process of promulgating rules, and we now have the most comprehensive set of drinking water standards for PFAS anywhere in the country. And a couple of things I want to point out to you here is for PFOA and PFOS, compared to the 70 parts per trillion of combined concentrations, the standards are 8 and 16, so much lower than what we had originally been working with as an advisory level. And also see that concentrations vary by compound from 6 to 400,000 parts per trillion. Given a number of different factors, they don't all behave the same and have the same impacts on us. So next slide, please. Now, the adoption of these standards did trigger a change in some cleanup criteria in the state as well. We had adopted standards for PFOA and PFOS in groundwater as we would start evaluating sites for whether they were contaminated and needed a response using that 70 parts per trillion level. The adoption of MCLs or drinking water standards in August of this year precipitated a change in the criteria for the PFOA and PFOS to the 16 and 8 that you see here on the slide. What's significant about that as well is that changed dramatically the universe of official MPART sites from 99 that had exceeded that 70 parts per trillion to 138, given the addition of these others. And go to the next slide, please. And again, just to put here, these are the 2 compounds now that are impacting whether we decide a location is a contaminated site, an MPART site. Only 2 of those 7 compounds. You'll hear us talk about the other 5, and Seisha and the health department will be looking at all 7 of those compounds, but from a regulatory perspective, and when we declare a site as an official MPART site, it's based upon just these 2. And the next slide, please. And so here, if you can see on this map, the 2 different colored locations, the purple ones there are the ones that exceeded that 70 parts per trillion that we've been working on and identified all along. And now the orange little squares, those are additional sites that are failing these newer criteria. And a thing to point out with is if you follow the numbers that we're advertising like back on August 3rd, of 38, 39 new sites. That's changing because MPART is continuing to investigate locations across the state. We've got a very prioritized strategy of looking at those that we think might actually have PFAS and whether or not it could or couldn't contaminate groundwater and whether or not it might migrate offsite and impact drinking water. And that's why we've been so successful at identifying these quickly. Another thing to note is if you pay attention nationally, what people are saying about PFAS contamination, they'll say Michigan has more contaminated sites than any other state. And it's not because we're more contaminated than anybody else, it's because we're looking more aggressively than any other state in the country. Next slide, please. And I'll end my talk here with just a note to any of you who are in a community that has been impacted by any PFAS contaminated sites, is MPART adopted a citizens advisory work group last year. And what we're doing is we're asking residents from impacted communities if you're interested in helping to advise MPART on how we engage and empower communities, even things like this virtual town hall tonight, and then much more broadly, how we provide information to residents who may never even be part of an MPART investigation, educate them on the what PFAS are and what the state is doing about it. All you need to do, and the URL is at the end of this presentation, is go online and register, and then we will bring you into the group. And essentially, this is a group that meets once a month, Tuesday evening, second Tuesday evening of the month, 6 to 7:30. They've been meeting virtually for over a year now. And it's a very good group, very engaged in trying to come up with, first, evaluating what we do in MPART, and secondly, coming up with recommendations. So if you have questions about that, please reach out to me afterwards, and I'd be glad to help you out as well. So next slide, please. Now I want to turn it over to Seisha, and she's with our Department of Health and Human Services to talk a little bit about PFAS and health. So Seisha.
Thank you, Steve, and hello, everyone. Once again, this is Seisha Kalakuri, toxicologist with the Michigan Department of Health and Human Services. Thank you all for attending the webinar this evening, and I hope you and your families are safe and doing well, given the current pandemic. And I shouldn't be taking too long here since Director Sliver has already covered some of the PFAS basics in his presentation, but I'll be providing some more information regarding the ways people could come in contact with PFAS and what we know about the health effects associated with such exposure. So our role is to try and understand the environmental contamination and how that impacts health of the people in your community. And we work very closely with the local health departments to investigate and address any health risks these chemicals may cause. So while EGLE leads the site investigation, meaning figuring out the nature and extent of contamination at the site itself, the health departments, both us at the state level and the local, we lead the public health planning and the response side of it. And in doing so, we evaluate PFAS exposures to residents in the community based on the available data or any site-specific information. And this will help us make the appropriate public health recommendations. Next slide, please. So in the earlier presentation, you've seen the various examples for PFAS sources, and this slide explains the different ways you could be exposed to PFAS. If you understand exposure, you can prevent exposure. Because once in the body, PFAS cannot be treated or chelated out. It has to be excreted out in the urine based on the elimination rate. And that rate varies for each of the chemicals within the family. And it gets really challenging for ongoing exposures. So it is important to understand the various routes of exposure. Our major route of concern is via drinking contaminated water or eating fish caught from contaminated waters. Where the PFAS levels are of extreme concern in a certain water body, we issue a health advisory that says, do not eat fish because PFAS, especially PFAS, which is perfluorooctane sulfonic acid, is known to bioaccumulate. Like Director Sliver mentioned, it means that the levels tend to build up in fish. Then there is incidental swallowing of PFAS contaminated soil or dust. This is especially a concern in infants and children because of the hand-to-mouth behavior. And some of the other exposure routes are eating food packaged in PFAS-containing materials or even using some of the consumer products. And the last thing to note, and something we often get a lot of questions about, is skin contact. So touching PFAS-containing products is not a concern because PFAS is not easily absorbed through the skin. The scientific evidence we have to date shows that skin contact is not one of the major ways people are exposed to these chemicals. So it is okay to do dishes, shower, or bathe in water that has some PFAS, and it is believed not to increase exposure. And inhalation or breathing PFAS, which is not shown here on the slide, the previous slide, please, is a more likely exposure route in a work setting, such as a PFAS manufacturing company, rather than the general public. Next slide, please. Thank you. So given their widespread use and persistence in the environment, the Center for Disease Control and Prevention, in short, the CDC, as part of the National Health and Nutrition Examination Survey conducted between 2000 and 2014, found that PFAS is present in 98% of the United States population, which is nearly all the people that were tested as part of the study or the survey. So both PFOA and PFOS were manufactured between late 1940s and early 2000s. And note that the PFOA or PFOS levels shown here in the graph, dropped significantly in blood since 2000. And this is due to the decline in production and use of PFOA or PFOS. But people may still be exposed to the other PFAS chemicals within the family or their replacements. And as I mentioned earlier, if there is continuous and repeated or prolonged exposure, PFAS could build up in people. Next slide, please. So here's a slide showing the potential associated health effects from PFOA or PFOS exposure, such as lowering a woman's chance of getting pregnant, increasing the chance of high blood pressure in pregnant women, increasing the chance of thyroid disease, and increasing cholesterol levels, and then changing immune response, which is basically the body's ability to fight off sickness, and then increasing chances of certain types of cancer, such as kidney and testicular. So many scientific articles have been published in this important area. However, I would like to highlight that we are learning more about the toxicology of these chemicals even as we speak. It is difficult to show that PFAS directly causes these health conditions in humans, because studies have only shown that PFAS exposure may be linked to such harmful health effects in humans. So it is important to note that these are only associations or probable links from oral exposures, meaning via consumption of PFAS, and primarily PFOA and PFOS, and studies conducted in humans alone cannot definitively prove causation of a certain health effect. And there is limited to no data for the majority of other PFAS within the family to conclude that this is a cause-effect relationship. Also, most of these studies were conducted in people exposed to high levels of PFAS, like in a work setting, or affected communities due to a known high-strength PFAS source contributing to the contamination in the area. And most people, even when exposed to these high levels, did not show any health effects, which is another important reason why it's difficult to prove causation. And although animal studies were done mostly on rats or mice to understand what might happen in people, they may not be the perfect predictors of effects in humans because, as we all know, animals and humans process these chemicals very differently. However, animal studies are considered an important marker of scientific discovery. And you may not have health problems from PFAS now or in the future, but if you drink water with elevated PFAS levels, which is also our major route of concern, as I mentioned earlier, over time, you could be more likely than the average person to develop some sort of health problems in the future. And that's my talk. And I would now like to pass on the virtual mic over to Fred Sellers with EGLE. He's the district supervisor for the Kalamazoo and Grand Rapids district offices. Fred, the floor is all yours.
Thank you, Sasha. So as Sasha said, I work with EGLE in the Kalamazoo and Grand Rapids district office. I'm also the regional lead for MPART site investigations in the Kalamazoo region. Along with me, Amy Peterson, who's not with us tonight. She's the operations manager for PFAS, and she's also the regional lead for the Jackson region. So tonight we're going to hear from 5 staff to briefly discuss some of the most recently added PFAS sites. 2 of them in the Jackson district, Liberty Environmentalist landfill, Werkner Road landfill, and then 7 in the Kalamazoo district. We're going to start with Brett Coulter in the Jackson region. Brett, you have the mic.
Thanks, Fred. My name is Brett Coulter. I'm a geologist with EGLE in the Jackson District Office. The more stringent PFAS rules have pulled 2 facilities in the Jackson District into the MPART PFAS process. The first site is Liberty Environmentalist Landfill, shown here. The landfill is located in Clark Lake, Michigan, Jackson County. Liberty is an active construction and demolition waste landfill. Next slide. This figure shows the regional groundwater flow for the site, which is typically west-southwest for the Westfill area and south-southeast for the Eastfill areas. EGLE requested the landfill to collect PFAS samples in 2019 since PFAS is present in leachate generated at the landfill. At that time, 5 samples were collected on site. Next slide. The initial PFAS sampling results showed PFAS detections, but none of these were above the drinking water criteria at that time. However, with the passing of the more stringent PFAS criteria in August of this year, 1 monitoring well exceeded the drinking water criteria for PFAS. The drinking water exceedance is west of the landfill. EGLE is working with the landfill to collect additional on-site sampling for PFAS to better understand its extent. Next slide. Second site in the Jackson District is Werkner Road landfill at 8027 Werkner Road in Chelsea, Michigan, Washtenaw County. Werkner Road landfill was a municipal solid waste landfill that was closed in the late 1980s. Next slide. This figure shows the regional groundwater flow direction at the site, which is generally east to northeast. Again, EGLE requested the city to collect PFAS samples in June of 2019 since PFAS is present in the leachate generated at the landfill. At that time, 6 samples were collected on site. Next slide. The initial PFAS sampling results showed PFAS detections, but none were above the drinking water criteria at that time. And again, with the passing of the more stringent PFAS criteria, 2 of the monitoring wells exceeded the drinking water criteria for PFAS. The drinking water exceedances are east of the landfill. Additional on-site and off-site sampling for PFAS will be completed to better understand the extent of PFAS at the site. EGLE is working with the City of Chelsea, local and state health departments as well to conduct off-site residential water sampling. Next slide. And with that, I'll pass it over to Erica Bays in the Kalamazoo District.
Thanks, Brett. I'm Erica Bays, an environmental quality analyst in the Kalamazoo District Office, and I manage contaminated sites in Kalamazoo and Van Buren counties. So tonight I'm going to take a second to talk about the Aeromotive Company site. The site is located at 5688 East ML Avenue, which is in the southwest quadrant of Comstock Township. It's between exits 80 and 81 off Interstate 94 in Kalamazoo, if you're familiar with the area. The former Aeromotive Company was a cable and hose reel manufacturer, and some of the spools and blocks that were used in the reels were plated to resist corrosion. However, the exact source or uses of PFAS are not well known or documented for this site. The groundwater flow in the area is to the north toward the Kalamazoo River, and the geology at the site generally consists of sandy soils underlain by a clay confining layer. EGLE initiated PFAS sampling at 20 existing on-site groundwater monitoring wells in late 2019 due to the historical operations that may have involved PFAS or PFAS coated or containing products, including slated products, and potentially the parts washing and degreasing activities that took place on the site, as well as the known historical on and off-site groundwater contamination and the presence and close proximity of residential drinking water wells. Next slide. As Steve mentioned earlier, there are 7 PFAS compounds that have MCLs, and 2 of those 7, PFOA and PFOS, or PFOA and PFOS, have Part 201 criteria as well. So PFOA, PFOS, and PFHXS were detected in on-site groundwater monitoring wells exceeding the Part 201 criteria and or the MCLs. So if you're looking at the figures, north is toward the top right corner of the map or your screen. And the site is located on the south side of the 2-lane highway, the gray road, which is I-94. The groundwater monitoring well locations are shown as the squares on the figure. I know it's kind of difficult to read. And then the residential wells are the circles. So the figure on the bottom left depicts concentrations of PFOS, and the top right is of PFOA. The green indicates that PFOA or PFOS is not detected at a particular location. Yellow is between 0 and the criteria, and red means it exceeded the Part 201 criteria in this instance. So the highest concentrations detected on site of PFOA was 40.5 parts per trillion, and that criteria or MCL both are 8 parts per trillion. PFOS was 26.6. and PFHXS was 77.4, and that was all on site. So due to those exceedances of the MCLs and the criteria, we decided to sample 12 down gradient residential wells in coordination with MDHHS and the Kalamazoo County Health and Community Services Department. So those again are the circles to the east, or excuse me, the west. PFAS compounds were detected in 3 of those residential wells. So again, the circles and the yellow indicates that the detection was between 0 and the criteria. So none of those exceeded the Part 201 criteria, nor the MCLs for any of the PFAS compounds. All of those homeowners were notified of their results by the health department. And the health department also has plans to resample those residential wells for PFAS in the next 6 to 12 months. EGLE is also working on and in the process of implementing a remedial strategy to mitigate the off-site migration of PFAS as well as other chemicals of concern related to the historical operations at the Aeromotive Company site. Next slide. And I'll hand off to Dan Peabody from the Superfund section.
So my name is Dan Peabody. I'm the project manager for the Kalamazoo River Superfund site, otherwise has that big long title on the screen. And I have 3 separate locations today that are going to be listed as PFAS sites. So the first one is the Allied Paper Landfill, or we refer to it as OU1. At this particular property, EPA is a regulatory lead, the state provides support, and the site is managed by the trust. It's located at 268 East Alcott Street and is bordered generally by Alcott Street to the north, Burdick Street to the west, and Cork Street to the south. The site is approximately 89 acres in size and is defined by historic papermaking operations that occurred on the property. Shallow groundwater generally discharges towards Portage Creek, while the deeper groundwater discharges kind of in a northeastern direction, but exerts a strong upward gradient and is influenced by Portage Creek. My nearest private well is approximately 2.5 miles in a northeast direction. No residential well sampling is planned at this time. Next slide. PFAS at this site was first sampled for in 2018 by a trust. The part of the site that was sampled was a groundwater extraction system located generally in the southern portion of the site. As a follow-up to that, an extensive multimedia investigation was completed, where paper-making residual materials as well as granular fill, surface water, and groundwater were sampled. In general, PFAS are present in all media at the site, as well as surface water entering, kind of passing the site. The highest concentration observed was collected during the original investigation from a sump, which was a total PFAS of 1,854 parts per trillion with a PFOA of 730 and a PFOS of 790. Next slide. For this particular project, this landfill site, the cleanup hasn't been completed, but we're progressing through the design. And that cleanup is anticipated to begin sometime in 2021 and take maybe 3 or 4 construction seasons to complete. Next slide. So now this is a separate site, but still again part of the Superfund project. This is the Willow Boulevard and A site landfill. Again, here EPA is the regulatory lead. The state provides support, but this time the work is performed by a responsible party, which is Georgia Pacific. This particular property is located near the intersection of Lake Street and Olmsted Road and is approximately 32 acres in size. The eastern portion of the site actually falls within the Kalamazoo Township, while the western portion would fall within the city. In general, shallow groundwater would discharge towards the Kalamazoo River and Davis Creek, which you can see on the map border the site to the north and the east. And the nearest private drinking water well is located approximately 0.9 miles north of the landfill across the river. And at this time, no residential well sampling is planned. PFAS were first sampled for in October 2018 by Georgia Pacific based on their knowledge of PFAS contaminants in paper-making operations, as well as other liabilities that they have around the site. In general, again, PFAS are present in groundwater at the site. The maximum concentration observed was 345.8 parts per trillion from monitor well MW5A, which is located generally along the northern central portion of the site. A PFOS concentration of 150 at that same well and a PFOA concentration of 81. One important thing to note for that particular site is that we did see some upgradient concentration suggesting there may be an off-site PFAS source. For the next site, I got OU3. This is the King Highway landfill. This site is just due west of the previous property we just discussed. For this particular property, the state is the regulatory lead. The EPA provides support, and work is performed by, again, Georgia Pacific as a responsible party. It's approximately 23 acres in size and is located near the intersection of King Highway and Michigan Avenue. The groundwater here discharges generally towards the Kalamazoo River, which borders the site kind of to the north and to the east. And again, the nearest private drinking water well would be located approximately 0.8 miles north of the landfill across the river. And no residential well sampling is planned at this time. Again, Georgia Pacific sampled groundwater for PFAS in October 2018 based on their knowledge of PFAS and paper making operations, as well as other liabilities that they manage around the site. Maximum concentration is observed at MW13AR, which is located again along the northern central portion of the site. At that monitor well, we had a total PFAS of 84 parts per trillion, a PFOS of 49, and a PFOA of 21. Next slide. And now for this, I'll pass on to Leanne Thor.
Thank you, Daniel. I'm Leanne Thor. I'm the geologist for EGLE out of the Kalamazoo District Office. And I'm going to talk about 2 sites today. Southeast Berrien County Landfill is the first one. This is located in Niles at 1540 Mayflower Road. And it is currently an active municipal solid waste landfill. Next site. Groundwater flow is to the northeast, as it's pointed out here on this diagram. In 2019, we requested that they do some PFAS sampling. It was just part of a survey that we were doing based on several different factors, proximity to residential wells and that type of thing. They sampled in October of 2019 and they collected 4 locations for samples. And the results showed that monitoring well 7, it exceeded the criteria. They came in at 16 parts per trillion of PFOA and non-detect for PFOS. There are no immediately down gradient residential wells. As far as drinking water goes, they are all hooked up on the city, and the local health department is confirming nearby residents are connected to that municipal water. They're currently in the process of doing that. Next slide. And Lastly, we have Westside Recycling and Disposal Facility in St. Joe County. And they're located along M60 West at 14094. And that's just outside of Three Rivers. This site consists of both the active and the closed municipal solid waste landfill. That's like your regular garbage. And they do also take industrial and construction and demo waste at their type 3. Let me correct that. They stopped doing that in 2004. So that's capped and that's done. Next slide. The groundwater flow that we're seeing here is generally to the northeast. And due to the historical contamination that we have seen on the site, we requested the PFAS sampling in 2019. In December, they collected 4 samples at 4 locations. Next slide. 2 monitoring wells exceeded the new criteria of 8 parts per trillion. What we were seeing is MW6S, which is located at the top of the screen there in the diagram. And that was 56 parts per trillion of PFOA and non-detect for PFOS. MW9S was 28 parts per trillion of PFOA and as well non-detect for PFOS. We are working with the local health department to determine if there are any residential wells that need to be evaluated. Westside has been cooperative with EGLE and other agencies during this investigative process. So we're still looking into wells that may possibly need some sampling conducted here in the near future. Next slide. And next we have Michael Baranowski. Take it away, Mike.
Thanks, Leanne. I'm Mike Baranowski, a project manager with EGLE here in the Kalamazoo district, and I'm going to talk about the city of Sturgis, or the former Big Hill landfill. Yeah, this landfill is on US Highway 12, about 2 miles east of downtown Sturgis. It's the intersection of Big Hill Road. The landfill itself was on the northeast corner of that intersection. Back in the 1970s, MDOT was expanding US 12, and while bypassing the former landfill, they encountered drums of industrial chemicals that indicated there might be a contamination problem coming from the landfill. The state asked the city to evaluate that contamination, and the city found that they had a large solvent plume running off with groundwater flow to the south. Next slide, Fred. To the south is a series of pumping wells that the city operates to pump contaminated water, which is treated in an aeration pond. This has been done since the 1980s. This system is operated by the city's wastewater treatment plant. In 2018, the city wastewater treatment plant evaluated its treated water streams that included water treated here at the former landfill. They found that they had about 6 parts per trillion PFAS in the groundwater. The state asked the city to evaluate the water they were discharging from this treatment system to a wetland to the south. That was conducted in early 2019. Both effluent streams that were tested were found to be below the criteria at that time. The state again asked the city to test downgradient wells to see if they had a further offsite migration problem. The city did that testing also in 2019, and they found they had PFOA at 10.4 part per trillion, which exceeds the current criteria. And as a result, next slide, Fred. Here's the southerly groundwater flow. There's a series of residents and commercial entities that live south on Big Hill Road and south of the wetland depicted on this figure. And this area has approximately 11 private water supply wells located in it. The city requested permission to sample those wells. 9 residents and commercial entities agreed to have their water tested. The city tested that water last month and is waiting for the results. And that's the Big Hill landfill.
Thank you, Mike. So just a second here. I'm going to put the EGLE site contact information for the sites that were just discussed. So, you know, if you need to reach out and contact somebody, if you can, you know, write that information down or take a picture of your screen or something so that you have that information. I'll give you a second to do that. And if you have questions, you can ask those questions and we'll be happy to provide that information if you don't catch it right now. Additionally, we have contact information for the local health departments for each of the 2 regions. I'll give you a second again if you want to take a picture of that, or if you want to jot down the contact phone number for those local health departments. And now we're on to questions. So I'm going to hand the mic back to Les and Jim, and go ahead, guys.
Hey, thank you, Fred, and thank you to all of this evening's presenters. We've started to receive questions this evening about the content of the presentations. And while we're waiting for additional comments and questions, I just want to remind our attendees this evening how you can ask a question this evening. So you can use the question and answer box located at the bottom of your screen to ask a question, type it in, and we'll read that aloud. Second option is to raise your hand, and I have at least one person that's interested in making a verbal question or answer, question or statement. And the third option is for our listeners who are listening by phone only. You can touch the star and the number 9 on your phone to electronically raise your hand to ask a question, and we will see you that you wish to speak. So with that, we have some questions that have come in. And I want to take one of the first questions, actually the last one that's come in. There's a lot of information that's been given tonight from our presenters about the various sites and about PFAS and PFOS and the other 5 contaminants. This presentation will be posted on the MPART website. Also, we will be sending the video out for closed captioning, and once we receive the video back and have it closed captioned, we will be posting this also on our EGLE webpage. So just to answer that question, that yes, this information will be posted in a couple of places on the EGLE's website. There were a couple of questions that were asked this evening from a couple of panelists with regards to PFOS and PFOA that were directed to Director Sliver. Question that was asked, and want to read this out for our folks that are on the phone who may not be able to see this question and what the answer is. So how are the other 5 regulated PFAS components, the non-PFOS, non-PFOA contaminants addressed at MPART sites? And when they are, how are these addressed when they exist above non-detect levels? Director Sliver, can you address that?
Sure, Les, thanks. And so yeah, basically, and I should have mentioned during my presentation, those other 5 are still being considered by our public health professionals. If they're found that they are considered in the risk evaluation, especially when you're looking at a residential well and potential impacts and need for any public health actions like alternate water. I should also have added that we need to go through a rulemaking process for those other 5 PFAS compounds that are now MCLs beyond the PFOA and PFOS. We have to go through a regulatory rulemaking process under Part 201, our cleanup program in the state, before those other 5 would become enforceable. It's those first 2 that we had been using, PFOA and PFOS, MCLs automatically translated into the cleanup criteria because we already had some.
Okay, thank you, Director Sliver. Next question that we have is a question about the Huron River, but this question could probably be applied to other rivers as well. People are still fishing on the Huron River. Can the Department of Health and Human Services patrol the river around Ypsilanti and downtown to talk directly to fisher folk? Can they provide substitute protein for those in need? The posted signs are few and far between. Can Department of Health and Human Services talk about this, and maybe Tammy from the Department of Natural Resources?
Okay, I can go first. So as far as patrolling the river, I mean, we can provide our public health recommendations based on the surface water levels and what's found in the fish, but we can't really restrict folks. And I'm not sure what kind of signs are at the Huron River, whether it's do not eat fish or saying that PFAS was found in the fish and at what levels. But again, like I said, we can't impose that on people other than just putting those signs up. And Tammy, if you want to add on top of that, please go ahead.
Thank you. DNR's role in all of this is to support the communications aspect and to provide, to help collect the fish for analysis on this. So while we do additional communication with anglers, the notification and things like that is within the DHHS.
Okay. All right. Thank you, Tammy, and thank you, Stacia. Next question for Mr. Peabody. This is a question for you. What is the cleanup design that is in place for the Allied Paper facility? This is a two-part question.
So in general, the cleanup is excavation of soils across the site, and then kind of capping, consolidating, stacking, and capping those materials on site.
Okay. The second part of that question is, can you speak to the viability of capping in lieu of excavation as a mechanism for achieving closure of a site of PFAS contamination?
That seems more of like a general question. So probably not. I would just say for OU1, the remedy has already been kind of picked. And at this point, we're pretty far along in the design process. There are a lot of those design documents available specific to OU1. If folks are interested in seeing kind of what that looks like, I can provide them that information.
Okay.
I did want to say one more thing too, actually, about the
Sure.
the river folks fishing on the Kalamazoo River. We do actually engage with a local community group, with the Watershed Council for the river, and we do have a river walker program. So we do have people going up and down and engaging with folks that are seen taking and harvesting fish. And then we do also help manage additional signs and sign postings along with DHHS and the Watershed Council as a cooperative effort. So for this particular river in this region we were talking about, if folks have suggestions or input, we're always looking for it. So please feel free to email us those suggestions for additional signage.
Thank you, Dan. We did have a hand raised, but I didn't want to, I still want to give this person an opportunity. If Jennifer D would like to speak, and she have a question. Jennifer D.
Hi, I'm so sorry. I believe I actually accidentally raised my hand.
Okay, no worries. Okay, thank you. Okay, at the present time, we have a new question. Okay, first, the question is, when does EGLE expect to, I'm sorry, let me repeat. When does EGLE expect the other 5 non-PFOA contaminant compounds to undergo rulemaking for applicability to Part 201 standards?
Well, I'll take that one. And, you know, right now, I don't know that we have a specific timeline in place. We have not started that process, but that is something that we are evaluating right now on what the best approach is to proceed. But again, like I pointed out, you know, in the meantime, the other 5 are being used to evaluate public health risk, and that is our priority, is to recognize that we've got agreed upon standards for those other 5 compounds, and they will be used. DHHS looks at those values and others when they evaluate public health risks of PFAS in drinking water systems. So they're not being ignored. It's just right now they are not a driver for some of the other investigation work across the state.
Okay, thank you, Director Sliver. Another question for you, Director. Are there other excuse me, are there other meetings similar to this one as we are holding tonight? Are there other meetings scheduled around the state in other regions?
Yes, in fact, there's another one tomorrow, I believe, is for the Lansing area. And then next week we have scheduled Tuesday, Wednesday, and Thursday and the final one, I believe, is for Grand Rapids, and that is on September 28th. And again, the idea of these is to, introduce, to communities that may never have even had a PFAS site in them, that we found these locations and that we are, taking steps to better understand what the implications are of the contamination, especially if any is going off-site. And there may be follow-up town hall meetings in specific communities as we proceed further with these investigations. This is a pretty high-level review because we're covering multiple sites in each one of these regional webinars. But I just want to add as well, you've seen the project leads today, and my contact information. Don't hesitate to reach out to any of us, if you've got questions, and go to the MPART website. We have each one of these sites has write-ups out there on the web. We will keep those updated as we go forward. And we'll make sure that we keep your local health department and municipal officials, fully apprised as we go forward. They're part of the MPART team when we start, looking and investigating these locations.
Okay, thank you. Thank you, Director Sliver. Fred, if you wouldn't mind, if you could go back to the slide that has the contacts, staff contacts, give our attendees another opportunity to catch that information. If you hold that right there while I ask this next question. Next question is, does the public health risk standing alone grant EGLE the authority to compel testing for the non-PFOA/PFOS compounds in Part 201 sites?
So without getting into all of, I guess, the legalese, I think, my perspective is looking at this as MPART, where we have multiple state agencies pulling in all of our resources and capabilities together to respond to public health threats. And there's other statutes out there, the Public Health Department, Department of Health and Human Services has, for example. And so at the end of the day, we're not going to wait to force someone to evaluate something if we're concerned about it. That's what you've seen happen across the state where MPART has been in communities, testing private residential wells where we may not even know who the responsible party is. Because again, our priority is to understand that occurrence and make sure that we reduce exposures.
Okay, thank you.
Yep.
We don't have any additional hands raised at the moment, nor do we have any new questions that have come in. Again, we just want to let you know that the departments and the agencies represented here today are here to answer your questions. And the contact numbers have been provided for you, as well as the local health departments. If you have health questions concerning potential PFOS, PFOA exposure. I presently don't see any new questions. Director Sliver or any of the panelists have any other closing remarks they would like to share with our attendees?
Well, I'll just close myself by saying thanks everybody for joining, and not only the residents in the communities there, but the rest of the MPART team who's been here as a resource if we needed them. And again, this is the beginning of communications in many of these locations in your communities. When we have more information to share, and especially as we go proceed with any offsite investigations, we may have more specific town halls tied to a specific location. And again, go to the website there if you're interested in participating in a Citizens Advisory Work Group. We have about 28 representatives of communities across the state who are meeting right now. And we welcome others who are interested in assisting MPART in engaging communities and educating the public more broadly. So thanks very much, everybody. I really appreciate the opportunity tonight.
All right, thank you. And to our attendees, thank you for the time that you spent with us this evening. Just a reminder, the slides and the recording will be made available in the coming days, and an announcement will be made letting you know that the recording and the presentations will be available on the MPART website as well as the EGLE video of the EGLE YouTube channel. Again, thank you for your participation this evening, and have a wonderful night. And it will conclude tonight's webinar. Thank you.